Thank you for being here today. I apologize that I cannot be present for today's conference. I want to thank the organizers and the organizations that have generously sponsored the conference, in particular, the Public Health Woke Coalition, Health and Medicine Policy Research Group, the School of Public Health at UIC, and the Coordinating Center for Public Health Practice. Since I first took office as the Commissioner of the 7th District in 2010, health access has been a high priority for me. So much so that we created the 7th District Health Task Force to focus on the health and social issues facing the Southwest side. The 7th District Health Task Force has held community meetings and facilitated discussions about access to health care and the role of the Cook County health system. While I'm proud to say that our county health system serves as a safety net for our most vulnerable population, our county allocation, the amount of money we put in the system to health, and the system has been decreased yearly. We can and must do better for Cook County residents. While the Affordable Care Act has made it possible for the county to receive reimbursements for some patients, immigrants continue to be left out of the benefits of the Affordable Care Act. That's why I support Medicare for All Act of 2017 and the corresponding expanded and improved Medicare for All, known as House Resolution 676. This resolution would automatically cover everyone from birth, regardless of immigration status. Too many residents today have to forego or delay medication. Still others lack access to preventable services. And the lack of mental health services in Chicago alone is a public health crisis. In order to have a system that respects healthcare as a human right, I support a universal single-payer system that ensures care for all residents of the U.S. Children and youth have exhibited higher levels of stress, anxiety, and hopelessness over the last year. Clinical visits throughout the county have declined. The Muslim ban, the termination of temporary protective status for immigrants, the attacks on family-based immigration, all of these policies have a real health effect in our communities. The uncertainty regarding the DREAM Act has put unimaginable stress on DACA-eligible youth and their families. Today's conference could not come at a more crucial time. It's time for our healthcare systems to stand up to protect the most vulnerable. Here in Cook County, I have fought to make sure that immigrants and other vulnerable populations have equal access to services. Public institutions, especially healthcare institutions such as the Cook County Health and Hospital System, have a special responsibility to model the creation of safe spaces and sanctuary healthcare. Unfortunately, the Cook County Health System has been slow in responding. The County Department of Public Health and the healthcare staff have yet to receive training specifically geared towards dealing with ICE threats. Months after community pressure to adopt welcoming policies, I've finally been told that a training is being developed. Signage has been created and is slowly being posted. Regrettably, this response comes over a year late. Luckily, there are positive proven steps that healthcare systems can make to be welcoming. One, they can establish healthcare centers as safe spaces, create signage that makes it clear that all patients, regardless of race or ethnicity, are welcome. Two, we can require a warrant for any law enforcement official seeking access to patients or patient information. Three, provide training to staff so that healthcare workers can understand the trauma that patients may be experiencing. And four, advocate for research that assesses the health effects of the current climate and policies. Take a stand against discriminatory rhetoric, engage in conversations with advocacy groups, and protect the rights of all patients regardless of immigration status. These steps are not complicated. Smaller healthcare centers, as well as larger systems, can adopt these simple steps. The healthcare of our overall community is at stake, and we must act to protect it. Thank you. I wish you much success. Let's keep pushing for fairness and justice.